Well, I met Bob because I was hired at the North Carolina Medical Society in 1996. It's funny because I was supposed to start right after Fran hit Raleigh, North Carolina. Bob actually called me to say, Pam, I'm sorry, but you're not going to be able to start on the day that we had planned for you to start because we still have trees down, the power's not on, and quite honestly, I'm not sure when we'll get to work. I think that phone call sort of set out the way Bob works. Very relationship-oriented and very hands-on right from the very beginning.
Over the 20 plus years he was with the Medical Society before he moved on to the Physicians Foundation, I really got to know him very well. He is somebody who just, when he takes something on, it is a total commitment to what he's doing.
I think the year was like 1996. Republicans were running the House and the Democrats had a 2-vote majority in the North Carolina Senate. And in that environment, we were trying to get everybody together to regulate patient interests in the managed care industry. But Bob has this idea, and it might have been a little bit influenced by Billy Davis Horn, our outside contract lobbyist. And his idea was that he would go rent a Moses outfit at the costume store and go down to the General Assembly dressed as Moses, okay, and tell the Speaker of the House to let my bills go. So he takes off his shoes and puts on this robe and this wig and takes this hook, and he starts walking down in the rain, walking down to the General Assembly, okay? And he's gonna walk around the legislative building and the legislative office building, and we're gonna find these people. And I'm like 200 feet behind him because it kind of, kills the act if there's anybody else around, right? It has to look like it's Moses. So Bob goes, he finds them. They're all meeting on welfare reform on the 4th floor, right outside the elevator lobby, right off the elevator, 421, I think. And he finds them in there, and he just goes in there and let my bills go, and gives the whole speech. And dadgummit, it was like a couple of days later, the next week, Richard Morgan has those bills up in his committee, and 1 or 2 of them passed, and it was like, it's a big deal. And it's emblematic of the type of stuff that Bob would do if he decided that he wanted something done. You would be mistaken to think that he would take anything off the table if he thought that it was legal and he could do it and it would make a positive difference. He would do it.
I felt privileged as his first president to see how effectively he reached out in so many different areas. For example, he brought together a number of independent state societies into one cohesive organization. We became a presence in the North Carolina legislature and in Washington, which we had never been before. We interacted with all the health organizations in the state. There were about 60 or 65 of those. He earned a master's in film at North Carolina State University, and one of the best documentaries he did was the story of a man who contracted AIDS through a blood transfusion. He took the film to Washington in the hope he could get compensation for those victims. He was not successful in that regard, but the film made a big impact on people. It was very successful.
I don't look at it as a legacy as much as I look at it as a responsibility to support collaboration. In healthcare, if we don't work together in a very cohesive and collaborative manner, we're not going to make the outcomes better. And one thing that I was a strong believer in is working with people, regardless of if they had a different opinion than I did, because I always wanted to make sure that we did the right thing, not necessarily my thing. And working with a lot of people afforded me that opportunity to figure out how better ways to collaborate, how to improve outcomes, and how to make the healthcare system in North Carolina better. And I think that's a legacy that I would want my organization to have. Having been around since 1849, the Medical Society has always wanted to promote the art and science of healthcare and making sure that the citizens of the state get the care they need when they need it. That's the type of legacy I would like the organization to have and continue to have, which is to promote collaboration and make North Carolina a better healthcare place to live in.